Ryan, thank you. Well, we're continuing our election coverage this morning, turning now to the future of health care. Joining us this morning, John Riggs, Senior Vice President and CFO over at Medical Center Hospital in Odessa. Good morning. Thanks for being here.
Thank you, Rebecca.
Now, I know that now that Trump is our president, he has said many times that he would repeal Obamacare. What would that mean for the thousands of people in West Texas who are currently using the Affordable Care Act?
Well, currently right now, the exchange is open for everyone to enroll in. And so I still think that's going to happen. President-elect Trump will be sworn in January. He said he wants to call a special session of Congress to repeal the Affordable Care Act. So even if that happens, people are going to have their insurance set for next year. If any changes are made, I think it will come in the following year in 2018. But the biggest thing for everyone to remember is that for the prices to get lower, which is what everyone's concerned about right now, because we've seen premiums double from one year to the next, is we have to get more competition within the market. So we'll have to get insurance companies to come back to the exchange.
Yes, well, and Trump has said, and I'm quoting him here, Obamacare has led to higher prices, fewer choices, and lower quality health care, and said that he'd like to bring a free market reform and that nobody should be forced to buy insurance if they don't want to. But what kind of impact could that potentially have on hospitals here in West Texas and around the country?
Well, there's 19 states that have not expanded Medicaid right now, and Texas is one of those states. That is one way to help. If we can get the state of Texas to expand Medicaid, that'll get more people with insurance or some form of coverage. It'll also help local hospitals here in Midland and Odessa.
Now, is there there's conflicting arguments that either getting rid of the Affordable Care Act or having the Affordable Care Act is causing is giving too much power to insurers. Where do you stand on that?
Well, I don't think it's really given the power to the insurers. What we're seeing, the big change in healthcare, is that we're seeing reductions in reimbursement, which is forcing changes in every aspect of healthcare, because not only they're reducing reimbursement, they're expecting higher quality, which is a good thing for the end consumer, and that's what we want too. Everyone wants to provide better health care, have everyone come back actually to the hospital less frequently. That's the goal for everyone to have a healthier community to live in. So that forces us to do our job better, which is a good thing. But that's what's really driving all this change, is the fact that healthcare costs are around 16% of our gross domestic product, and you can't have a service industry that has that much pull on our economy.
Okay, well, John, we appreciate you being with us this morning, and like you said, at least for now, the exchange is open, and so we may not be seeing some of these changes for another year.
That's correct.
All right, thank you so much.
Thank you, Rebecca.
And let's send it back over to Ryan for another check of our forecast.
Now, your weather on